Good afternoon, everyone, and thank you for joining the September Telehealth Learning Collaborative brought to you by the North Country Telehealth Partnership, which is a joint effort by Athena Health Institute and Fort Drum Regional Health Planning Organization. Before we get started, just want to introduce myself. My name is Nancy Del Mastro, and I am the new Telehealth Project Manager at AHI. Some of you may be familiar with me as I previously served as the Telehealth Project Specialist at AHI from July of 2019 to November 2020. And I have just returned in August to AHI as the project manager as Katie Cook has moved on from her role. AHI also has a new director of population health programs, Andrea Bonacci, who's on the line, and you will see her along with myself on the partnership meetings in the future. And we are both excited to work with you all. That being said, we are going to begin the meeting with the state agency telehealth updates. I see Kendra and Megan on the line. If you want to unmute and provide any updates from DOH.
Hi, Nancy, can you hear me?
Yes.
Hi, thank you. Megan is on also. I think our updates from DOH really are, we continue to work on development of the regulations. We are in a final draft and working with our legal department, really hoping that we'll have new telehealth regulations before the start of the new year. So those should be going out, I would say probably within the next month or so for public comment. They would be posted. And we have also sent a request to CMS. We're exploring SPA opportunities to expand reimbursement for store and forward coverage from the previous reimbursement at 75% prior to the public health emergency to 100%. And we're exploring opportunities for e-consult as well. And then also we do have, there is a concept paper which is out for an 1115 waiver that does have a comprehensive package for telehealth that we hope to move forward. And Megan, I'm not sure, do you have any comments or did I miss anything else to add? Megan and I have been working closely with the rest of our team on all of this. Megan, if you're trying to talk, you're on mute, I think still. Probably double muted.
Good afternoon, everyone. I'm sorry, can you repeat? I lost connection for a second. Can you repeat?
Oh, sure. Actually, I just outlined what we've been working on and just asked if I missed anything or you had anything else to add. I mentioned the regs and looking to move forward with, we've put in a request to CMS for store and forward and for e-consult coverage. And I mentioned the 1115 concept paper.
Yes, the concept paper. Yeah, that's all the updates from DOH at this time.
Great. Thank you.
Thank you. And we did get a question, which was, will we get to see the concept paper for that 1115 waiver? And I think that was published online. Can you just correct me if I'm wrong?
Yes, it is published. I can put the link in the chat.
Great, thank you. And I will also put that in the notes that I'll be sending out after the call.
Thanks.
Thank you so much, Kendra and Megan. Amy Smith is on the line. Amy, are there any OMH updates?
Hi, Nancy, and good afternoon, everybody. So at OMH, we did do an extension or a renewal of the commissioner's waiver. That happened in August, so that allows the same continued flexibilities related to telemental health for another 60 days. And we are finishing up our final edits to our amendments for the telemental health regulations. So we hope to see them get posted possibly as an emergency reg shortly. And I think that's it. I think that's all we have at this point as updates for OMH.
Thank you, Amy.
Sure.
And I see Kelly Grace on the line from OASAS. Are there any OASAS updates?
Hey there, I'm
Hi.
Kelly. Our only updates, pretty much the same as OMH. We did extend our commissioner's waiver as well, another 60 days to allow those continued flexibilities. And then we are actually in the final stages of reviewing the public comments we received on our regulation, and we'll be finishing that up in the next few weeks.
Thank you so much. And if there are any questions, feel free to pop those in the Q&A session of the WebEx. And I know that some of our state partners have to jump off the call a little bit early today, but so please get those in if you have any. And thanks again to our state partners.
Hi, Nancy, it's Kendra. I'm sorry. It probably also is important to mention that DOH is refiled for emergency regulations as well until we can have permanent regs in place.
Thank you. Sorry, I was just writing all that down for the notes.
And the
Thank you.
concept paper is an ask, so hopefully that will move forward. Thank you.
Got it. Thanks so much. And again, if there are any questions, feel free to pop those in the chat. Oh, we did get one in. Okay, from Susan. In New York, what is the current status of telephonic only telehealth services? Susan, can you just clarify if you're talking for, is that a question for DOH, OMH, or OASAS? But I think they might all be similar answers if someone wants to take that from the state.
I don't know, Kendra, if you want to speak up at all, but this is Amy. So there are the emergency regs in place that are allowing for the audio only. And for OMH, we are looking to include that in our reg going forward. And it is covered under the commissioner's waiver.
And that's the same for DOH. The audio only is included in the emergency regulations, and you can look for inclusion of audio only going forward.
Same with OASAS.
Thank you so much. So we will continue to monitor the Q&A box as the meeting continues, and we can address those either by just typing into the Q&A or following up after the meeting, because now we do want to switch it over for our featured presentation today. And I want to introduce Scott Kessler, who is the CIO at the North Country Family Health Center. And Scott is going to present on the North Country Family Health Center's RPM efforts. Scott, you could take it away now.
Can everybody see and hear me okay now? Sorry about that.
We can, but we cannot see your screen anymore.
Yeah, sorry, I had to unshare it to be able to get back to where I was. So I just wanted to thank everybody for inviting me to speak today, and especially FDR HPO for all their help. What we're doing today would not be possible without all the hard work of FDR HPO and specifically Bob Hunt. Bob's kind of a rock star in my world, and has really pushed this for many, many years. So unfortunately, under the circumstances, we've learned a lot, and I am absolutely willing to help anybody who, or any organization that might be struggling with RPM, and share my knowledge, even if it's just a conversation, trying to work some things out. So we are a FQHC, a federally qualified health center. Our main campus location is at 238 Arsenal Street, Watertown, New York. We also have brick and mortar facilities in Lorain, New York, Lewis County General. We also have many school-based health centers that are in the Watertown City School District and the South Jefferson City School District, and we offer dental, behavioral health services, and primary care services in the schools. I'm not going to read each slide, but if you have any questions regarding that, I think we have approximately, all in all, about 28 locations, and that would include the school-based and mobile dental practices. So we've had quite a history with telemedicine in general, and I'm going to bring this full circle. So no worries if I start rambling, just cut my microphone off. So we've actually worked very well with Eastman out of Rochester in the teledentistry program. And somebody might say, well, how does teledentistry work? So the service that we offer is geared towards folks with special needs. And what we do is we bring the patient and the family into our main campus dental office, and we have the initial consult with Eastman, and we use intraoral cameras that record, take stills. The surgeons will interview the parents, if you will. We then arrange for the transportation to Rochester from Watertown, and they have all of their dental procedures done under anesthesia that they couldn't get done here in this region just because the capacity isn't here. And then all of their follow-up are with our docs. We've also had extensive use of telepsychiatry, and we do have remote psychiatrists who help us manage the medications that our docs or our providers just don't feel comfortable with or is out of their scope, but we do act as their primary PCP. We also have a retinopathy program, which has been very successful. Thank you to FDR HPO again. We did use some Agnes software from AMD telemedicine in the schools, and that would allow us to attach peripherals, endoscopes, otoscopes, stethoscopes, derm cameras, and again, FDR HPO, led that for us, or it was very, very instrumental in making that happen. They also helped us figure out Bluetooth connectivity when the onset of the pandemic. We transitioned to Zoom Healthcare, and we're able to attach some of the other Agnes USB peripherals to that, and it worked out very well. And our behavioral health staff were really instrumental in helping make that happen. We were able to scale up very, very quickly, and we were some of the first in the state to be able to offer telemedicine services. But we also learned a lot, right? So previously we had assessed our capabilities before the pandemic, just in our needs assessment, things of that nature. Technology appeared to be the way that we could reach such a rural setting. And so in 2018, we began looking at what we were able to do. In 2019, our EMR was GE Centricity, and they spun that off into Verance Technology, and that was acquired by Veritas Capital, and then Veritas had purchased Athena Health, and so we were noticing that like the break fixes and the bugs weren't being worked out for Centricity, and the writing was kind of on the wall that they were going to try to transition us over to Athena Health. And in 2019, we ended up, making that decision to move. So in the summer of 2020, in the height of the pandemic, doesn't everybody switch their EMR in the middle of the pandemic? So we went through and we did all, the data migrations and everything, and it was very beneficial for us because there was a lot of new functionality that we just didn't really have. And so, we struggled through it. But what we did notice was that we had the model backwards. The telemedicine model was backwards, and we really needed to reach those folks that were in the rural areas like Lewis County. Some of Jefferson County can be very rural as well. And what we noticed was there was significant connectivity issues in the infrastructure. And the system itself only works as well as you're able to connect, right? So when we talk about telephonic is great, and it really did help our behavioral folks be able to, to talk to people, talk to their patients. And a lot of times they just didn't, all they had was a cell phone. So we didn't have a choice. And when New York State had changed the reimbursement rates, that was a breakthrough moment for us. Absolutely. We wouldn't be able to do, again, what we're doing now if we didn't have that reimbursement rate. So I thank you for that update from New York State regarding, moving forward. The other thing that we noticed was previously with Centricity, although they say that they have an API, we found that the API connections, or those interfaces, were so much easier to deal with than, say, an HL7 integration. Anybody who's played with HL7 understands that it's not always, very cut and dry. But the way the API works is it's basically an object, a data object that allows interoperability of data because it parses it. It knows what the function calls are expecting, what data types. You don't really have to massage it too much to get it to, to function properly. And this, it's called object-oriented programming, or OOP, and it's been around for a long time. It's not, it's not a new technology. So like Amazon uses them, some of these other like Facebook. So you can write an app for Facebook, you become an API developer, they give you the data dictionary. So you know what data types and what it's expecting to see, if you will. So we had significant amounts of money, both from the state and the federal government, to allow us to purchase what is called a Medpod. And so this Medpod unit that you can see in the picture it's almost like an R2 or something, sci-fi. It literally folds down into a suitcase with an extended handle, and it's on rollers. And again, this integrates with our new EMR. It's pretty much in real time. And with that API, what it allows us to do is to load a Chrome extension onto the provider's computer. And it's really as simple as being able to click on that tab and interact with this, this machine. So again, fiscally, we're very strong at the moment, but this device, again, doesn't really get to the meat of home monitoring or remote patient monitoring. So it does require a presenter, and we are using registered nurses because there is, like a patient evaluation kind of thing that goes along with that. They work very closely with our doctors, and so it's a great device. It's real time. It does insert discrete data points into our EMR, and it will also alert the providers when there's something out of range. So you can set, ranges or labs or whatever, so that the doc or the provider does not miss, what's going on. So where we are today with Athena is we have partnered with a company called Cures for You. And this is also talking to our EMR, which is Athena Health, through an API. And you can see the different EMRs that they've been successfully integrated with. There is a link at the bottom, and it's a presentation that basically goes into the offerings, if you will. So there's two different approaches. So we're using remote patient monitoring for blood pressure and pulse ox, and that was identified as a need coming out of COVID. So it's tied to a condition or a diagnosis. It measures the vital data. It gathers the data for as long as we need. So it's able to look at trends, and it is able to be viewed, either through their portal or directly in Athena. So it also works with a Chrome plugin, and the provider can just simply click on that, and it takes them right into what they're trying to monitor. So they also offer clinical care plans. So if there's an upcoming appointment or some type of procedure where, like you want to know somebody's blood pressure for a week before they have surgery, or, it could be anything. It gathers that data, and it is actually developed by the Cure for You team. So what is very unique about Cure for You, and I don't work for them, just a little disclaimer there, they've been fantastic. They also they also act as the technical assistant. So if your remote patient is having an issue with a device, it's not up to your technology department to work on that, or to talk them through that process. There's a 1-800 number that they call, and it's taken care of pretty much in real time. The way that we are doing this is we're identifying patients who may fall into a category that allows us to use the remote patient monitoring aspect of this. So it's not going to work for everybody, or it's just not a fit for everybody. We've found that identifying those patients that kind of click with technology, maybe they're younger, and it works very well. So these are some of the other offerings that we are using with Cures for You. So it's almost like they did a needs assessment, and they found that they need patient engagement. And so one of the things that we're using this software for as well is to be able to be compliant with the Cures Act. And I'm sure that many folks are struggling with everything that's contained in that. But the patient engagement is the big part. So when we look at what we can offer, can you see my list now, or no? You're just seeing the PowerPoint.
We actually lost the PowerPoint. Now it's like a grayed out screen.
Okay,
Now
so
we can see it.
all right, sorry about that. I have many monitors up. So the way that the software works is, again, it's kind of that central object, right? It's listening. We are able to use any eye health device, whether it's blood pressure monitors, glucometers. There's just anything that eye health is that's put out. Withings, any Apple activity tracker, or any type of like iWatch, we can grab that data off of that. And again, you need to have an internet connection. We can also use the Garmin, and I mean they have all kinds of stuff, Strive and Withings. So it really is quite extensive. Again, we started with blood pressure monitoring and pulse ox because of where we are, with COVID. And so I'm really looking forward to trying out some of these other products. So any Bluetooth device that can connect to a smart device, we can use an app on that smart device to pull that data off. And as long as the patient is using the monitor, we're able to grab that data and of course be able to trend it. So what if a patient is not compliant? Well, it will let us know, and it will also let the patient know, hey, you need to take your blood pressure, or please put your device on, or charge your device. So it really is quite interesting. And again, it's the connectivity, and we had the model backwards. So we were having patients come into the facility, and then the doc was either somewhere in the facility or at another facility. And with COVID, it just kind of turned everything upside down. But because we knew, we had such a history with it, that we were able to quickly adapt. And, it's been pretty amazing. We did not close. We laid a few people off, but they were brought right back within 2 weeks. And we're bigger now than we've ever been. And a lot of it has to do with, technology and how we were able to scale up. But we didn't do it alone. So again, if anybody, has any questions, or, you want to have a conversation, I'm more than willing to, to talk it through with you. And I believe that's all I really have.
Thank you so much, Scott. That was great. We did get a few questions in, so I'll go ahead and facilitate like a quick Q&A session.
Oh yeah, that'd be great.
What is the ballpark cost for the Medpod that you're using?
Yeah, the Medpod was really expensive, but we did get a grant, and I'm going to say it was somewhere around $50,000. But that included all of the integration as well.
Got it. Thank you. And this might be a question for our state partners, if Scott doesn't have an idea. Are there any plans at the state to allow FQHCs to be reimbursed for RPM in 2022?
I don't have the answer to that, but I would love to know the answer, because we're thinking that as well. And, and I completely understand. It's something that we had to do. And I don't know why the Qs, the FQs were kind of like carved out of that. But if the state can answer, that would be wonderful.
Kendra or Megan, I think you're still on the line. If you have any idea or any response, feel free to unmute and we'll give you a second. We could come back to that. And a similar sort of ballpark question, are you able to bill in your FQHC or just use the RPM program as a value proposition?
So we do bill, yes.
Thank you. How has acceptance amongst your clinical team been?
We have some that are hesitant, but they're hesitant with technology, period. So you kind of have to know your audience. We have some docs that are just phenomenal. They should have been programmers, but it's kind of been mixed. And you just have to work with them and, and let them see for themselves that it really does work, and it really helps the patient, especially, in these trying times. Behavioral health has been, although, it's kind of outside this scope, but the behavioral health has been a huge, huge part of our efforts.
Thank you. And then can you describe the patient response to remote monitoring?
Some people have been, great, and other people were like, well, we don't want to do, or I don't want to do that. And so you really do have to have like a care manager or somebody, talk to them. And it was interesting because, even with like just Zoom, patients, they didn't want to turn their video on. And that's why we were thankful for the telephonic aspect of it. And again, in behavioral health, the counselors eventually got the folks, if not on the first session, but eventually they were interacting, face to face, if you will, or through video as well. Yeah, it kind of depends on the person. So we also did get a grant, and we are providing iPads with SIM cards that we've locked down to just our instance. And those SIM cards, because we weren't really sure, what kind of data usage we were going to need. So we did go ahead and purchase the unlimited plan, the unlimited data plan. And we found that a lot of those folks were very, very appreciative because they didn't have that type of technology. They'd never had that, they never had an iPad or, a smart device, if you will. So yeah, I think people were very glad. And once they get into, the telemedicine piece, I mean, it's so amazing. What is available out there is kind of mind-blowing that unfortunately it took a pandemic for us to be able to move this forward.
We got a follow-up question regarding your response that you said you do bill for RPM. Can you talk a little bit more about that?
I would have to defer actually to finance. I'm not sure. And I may have misspoke actually. Well, we do bill for the Medpod unit, and that is, I don't know, a 3. I think that's a 3, but I can certainly find out from our CM folks.
Got it. Thank you. I think that clarified the question. And that was all of the questions that we did get in. We'll keep it open for a few more minutes. If anyone else has a question for Scott, feel free to either pop that into the Q&A or the chat box now. And while we wait to see if there are any other questions that come in, I'll go ahead and just share a couple of events coming up and updates with the group. But thank you again, Scott, so much for taking the time to join us today for the Learning Collaborative and sharing your program.
Well, yes, thank you.
We actually did just get a question in. There are numerous codes that you can bill under. Oh, okay, this was just sort of a comment related to, I think people were wondering if you were billing for RPM, and someone had noted that there were some codes that you can bill under. And thank you. There is another question for you, Scott. Would you recommend Athena EMR to others? Are there any pros and cons you could share?
Yeah, there's pros and cons to everything. I would say that the implementation was very different because there was no interstate, or excuse me, there was no traveling. And so the education piece was difficult. We also had to change our dental software. That's been a struggle. But the actual Athena product has been amazing. I was hesitant, of course, because we've been using GE Centricity forever, and we had a great relationship with our hosting company, and they helped us with other infrastructure. But the project manager or the implementation manager that we had from Athena was one of the best I've ever worked with, and I've worked with hundreds, and I've been very, very happy with our transition to Athena. It does require more management, if you will, from your organization, right? So they do put a lot of that configuration back onto your teams, and so that was an adjustment. We've always had excellent support from our hosting vendor, and it was a pretty big lift. And again, not having trainers on site or folks on site, that was probably the most difficult part. We are working with them to get somebody, get a couple trainers to come in, because it's something that you're always going to want to revisit, right? Training, you can never train your people, too far, if you will. And the RCM aspect was a change for us. We had previously outsourced that to our hosting company, and they only dealt with GE, Centricity. They were solely focused on that. So we did bring billing back in house, and it's gone fairly well. We had to, find some, super qualified people to be able to understand that billing component. But yeah, I've been very impressed with Athena.
Thank you, Scott. Looks like that was the last question, but again, if anyone else, right as I talk, someone writes something, but this is more of a comment. So that was the last question for you, Scott, but again, we'll leave it open for the remainder of the call, and we can always return to you if anything else does come in. So thank you again.
Oh, you're welcome. Thank you for inviting me.
Of course.
I'm going to stop sharing my screen now. Is that okay?
Yes. I'm going to go ahead and just talk. I'm not going to share my screen right now, but There are a few upcoming telehealth events that we added to the agenda that everyone received in the email that I sent out with registration. So this week, September 19th to the 25th, is actually Telehealth Awareness Week. This is an event that's being put on by the American Telemedicine Association, and they're hosting a whole slew of webinars and events throughout the week. So I'm going to go ahead and pop the link into the chat in case anyone wants to check out the opportunities that are available throughout the week. And it's just another great event that's bringing more awareness to telehealth, more education, and continuing on the conversation. Actually, I'm going to go ahead and share my screen so you can see what I'm looking at. And then I'm going to actually switch. We're here. There's a few webinars coming up from the Center for Connected Health Policy. On the 24th, there is a Medicaid and telehealth data collection webinar. Zoom in, and everyone should have gotten that registration link within the agenda I sent over. And then on the 1st, there's a Medicaid and other state agencies telehealth policies for patients with disabilities, also from Center for Connected Health Policy. And then another cool opportunity coming up on the 12th to the 14th is from the National Institute of Health Pathways to Prevention workshops. They are hosting an Improving Rural Health Through Telehealth Guided Provider-to-Provider Communications series, and there's 3 days of workshops happening. And that, I think, is a unique opportunity that I implore everyone to take a look at. Sorry, I'm just pulling my notes up on the other screen. The CMS actually just closed out their comment period for the 2022 physician fee schedule proposed rules. That being said, I'm going to pop in a nice fact sheet that the Center for Connected Health Policy created on all of the telehealth proposals within that for 2022. That's just a great resource for everyone. I just have to open up my chat again. And again, I will send all of these links in the notes that I will be sending tomorrow morning. But that's just another good fact sheet to have for the upcoming 2022 physician fee schedule. And then finally, we wanted to give a big thank you to everyone that attended last week's North Country Leadership Summit. The summit, which was a week-long virtual conference that was held by the North Country Telehealth Partnership, had sessions every day, 10 a.m., 12 p.m., and 2 p.m. And we had some great presentations from Netrix. Northwell Health spoke about their telehealth programs and many others. And all of those presentations are going to be archived on the Summit webpage in the next couple of weeks by the October 1st. So I'm going to pop that final link into the chat and keep that bookmarked in case you want to check out any of the multiple presentations on telehealth that were presented last week. If you attended, thank you so much. We're really excited about our presenters and everything that was shared with that. So I'm going to just take one quick look and see if there was anything I missed in the Q&A. that was it. Just a couple of comments that came in. So with that, I want to thank everyone for joining. Sorry it was a bit rocky. This is my first time hosting a learning collaborative in my new role, but we want to thank all of our state partners as well as Scott for joining us today and presenting. And I will be sure to get all of the notes out to you all tomorrow morning. And again, this is being recorded and will be on our website and the YouTube page if anyone wants to go back and reference what was shared today.
You did a great job, Nancy. Thank you so much for all your help. As you know, Katie did transition over to a different position, so Nancy has filled her shoes, and she's doing an absolute awesome job. So I wanted to make sure I took a brief moment and say thank you for all your hard work and stepping in and making this a continued success that it's always been. So thank you for all your great work, Nancy. It is greatly appreciated. You are certainly a key partner with FDR-HPO and the Telehealth Partnership. So thank you so much for that.
Thank you so much, Tom. Really appreciate you saying that. And you know, with that, we'll close out a bit early. Everyone could get a few minutes back in their day, which I think is always appreciated. And just to let everyone know, our next Learning Collaborative will be on November 15th from 2 to 3. And I'll be in touch, of course, with all the registration information and our next speaker for then. So with that, I hope everyone has a wonderful afternoon and look out for the notes and more communications on telehealth in the future. Thank you all so much.